Inspect the outer surfaces of the lips for symmetry, note any lumps, ulcer, cracking and scaling. With the help of tongue blade, inspect the oral mucosa for color and ulcers. Also note the color of gums, inspect the gum margins and interdental papillae for swelling and ulceration. And also check the teeth, noting any of that is missing, discolored, misshapen or abnormally positioned. Next, inspect the color and architecture of the hard palate. Inspect the anterior and posterior pillars, tonsils if present and pharynx. Look for redness and ulceration. To begin the examination of the neck, inspect the symmetry and note any masses and scars. Palpate the lymph nodes using the pads of your index and middle finger. Move the skin over underlying tissue in each area. Palpate the anterior superficial deep cervical chains including the supraclavicular nodes located anterior and superficial to the sternomastoid. Feel for the preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical and posterior cervical nodes. Palpate the posterior cervical chain along the anterior edge of the trapezius and along the posterior edge of sternomastoid. Now inspect and palpate the trachea for deviation. Place your finger along one side of trachea and space between it and sternomastoid. When compared to the other side, the spaces should be symmetric. Next, ask the patient to sip some water, then observe the upper movement of thyroid gland, noting its symmetry. Confirm your observation by palpating the thyroid gland. First, locate the isthmus, usually overlying the second through fourth tracheal rings. Palpate the adjacent left and right lobes as you stand facing the patient. Look for goiter and enlargement of the lobes. Again, ask the patient to take a sip of water and then swallow it. Feel for thyroid isthmus rising under your finger pads. Displace the trachea to the right with the finger of the left hand and with the right hand fingers palpate laterally for the right lobe of thyroid and then reverse the same process. Breathing for me. Okay. And just breathing. Conclude your examination of nose by palpating frontal sinus tenderness, pressing the frontal sinus from under the bony brows, avoiding the pressure on eyes, and then press upon the maxillary sinus.